The MMY1001 study was designed to explore the safety of daratumumab in combination with various backbone myeloma regimens, including proteasome inhibitors, immunomodulatory drugs. And so this particular subgroup is the addition of daratumumab to carfilzomib-dexamethasone. And while these results were presented at ASH, this particular subgroup analysis is looking at lenalidomide refractory patients. So the reason this cohort is important is because although we have a lot of phase 3 studies that have been published in high-impact journals comparing the addition of various novel agents to lenalidomide and dexamethasone, the problem is the vast majority of patients in the US who are getting lenalidomide maintenance would not be eligible for those studies because they've already become refractory. So there's really a need to look at outcomes of patients with lenalidomide refractory disease. And so in this particular study, the total cohort was approximately 85 patients, of whom about 50 were lenalidomide refractory. And what we find is that the response rate was comparable in both groups, about 80%, including stringent CRs and CRs and some MRD negativity. And I think perhaps even more impressive is the progression-free survival. The median PFS for len refractory patients was 14 months, and for the overall population not reached. And I think that's important because when you put it into context of other studies that have looked at len refractory patients, it's been as short as 4 months with POM-Dex to other regimens showing approximately 8 to 9 months. So this 14-month signal is very encouraging, and there's a large randomized study going on where carfilzomib-dex is being compared to the addition of daratumumab to KD, so DKD versus KD. So it'll be interesting to see those results. The other important, I think, finding from this study is really the ability to give daratumumab over 2 days, because one of the impediments to daratumumab administration in the community is the relatively long first dose infusion time. So typically around 7 hours. At academic centers, that's pretty straightforward, but at community practices, that can be a little tight. And so in this particular study, daratumumab was also studied as a split dose over day 1 and 2. And the median time for infusion was approximately 4 hours. And the infusion-related reactions were actually quite encouraging, about 37% in the first day, and then the second day, 3 to 4%. So I think this is a great option for patients and community doctors to be able to give daratumumab over 2 days instead of having to struggle with 1 day.